Part 2 of the measure deals with care and treatment planning and care coordination. It essentially consolidates existing Welsh Government policy guidance on CPA into legislation. And it does that by placing statutory duties on local health boards and local authorities in Wales to coordinate those mental health services that they deliver between them to ensure that they're as effective as possible. And more specifically, it places statutory duties on local health boards and local authorities to ensure that all individuals in secondary mental health services in Wales have a care coordinator appointed to manage their care and treatment as soon as is reasonably practicable. That's the language of that part of the measure. And it also requires that every individual accepted into secondary services has a care and treatment plan. The role of the care coordinator, that's pretty much all the measure says in Part 2. The face of the measure simply says services will be expected to coordinate to ensure that they're delivered in as effective a manner as possible. All individuals accepted into secondary services must have a care coordinator and must have a care and treatment plan. And that's about all the Part 2 of the measure says. So that's Part 2, care and treatment planning and care coordination. Part 3 of the measure does something different again. I really like this part of the measure. I think there's a sort of elegant simplicity to it. What Part 3 of the measure does is place statutory duties, once again, on local authorities and local health boards to make arrangements so that any individual who was in secondary mental health services but has been discharged from those services can go directly back to the secondary mental health service from which they were discharged and request a further assessment should they feel at some subsequent point that their mental health has deteriorated to such a state that they now need assessment and treatment again. There are 2 reasons. Lots of people say, what on earth is a provision like that doing in a piece of legislation? Well, when we were considering our policy options for this measure 3 years ago, we had evidence from lots of service user organisations that one of the problems with the way that secondary services are configured at the moment is often a service user will be on the books of a CMHT, let's say, but doesn't really need services any longer. They've recovered to the point at which they're quite stable, their conditions being well managed, but they don't want to be discharged from those services because they know if they subsequently deteriorate, it's going to take forever to get back to those services through their GP, waiting for a referral, waiting for an appointment. That's one reason for doing it. The second reason is that it's the other side of the coin. It's looking at it from the CMHT's perspective, the secondary services perspective. They retain, we know from anecdotal evidence that a lot of CMHTs, a lot of specialist secondary services keep people on their books, perhaps longer than they would ideally like to. For the same reason, they know that it will take a long time for that individual to get back to them if they do subsequently become worse. Therefore, by placing this statutory duty on services to make those arrangements to ensure that individuals can be fast-tracked back if they subsequently need to be seen by those services, they can self-refer back to those services. What we're looking to do is free up some capacity in secondary services by allowing CMHTs to safely discharge patients that they would otherwise perhaps retain on their books, and to ensure that individuals who are in services who no longer really stand in need of those services but are there because it provides them with a safety net, with a comfort blanket, have an opportunity to be safely discharged in the knowledge that they can access those services again through a self-referral. Part 4, finally, of the measure. Sorry, Hugh, I'm running over, but this will take but a moment. The 1983 Act, when it was amended in 2008, introduced a form of statutory independent mental health advocacy, IMHA for short. The existing IMHA scheme provides a statutory mental health advocacy service for individuals who have been detained under the long-term sections of the Act, 2 and 3 essentially. What Part 4 of the measure will do is expand that IMHA service in Wales so that it also covers the short-term sections of the Act. Not all of them. Originally we had proposed to include sections 135 and 136 as well, but we've backed away from that position for the time being. So instead, we're expanding simply to sections 4 and 5, which, as I'm sure the majority of you know, are the doctors and nurses' short-term holding powers. They last from 6 to 72 hours. So we're expanding the entitlement to statutory advocacy to any individuals who've been detained under those short-term sections. More importantly, perhaps, or more significantly, we're also expanding the IMHA scheme to all informal inpatients in Wales. That is anybody, any individual who's in a hospital or inpatient setting in Wales and receiving assessment or treatment for a mental health disorder. That's a pretty significant expansion of the scheme. It means the scheme, which currently covers about 2,000 individuals, will cover about 10,000 individuals from next year. Final point, there are our contact details. They're on the handouts that you were given earlier. I do circulate email updates to a vast list of stakeholders, many of whom are in this room today. But if anybody else wants to receive email updates from me as the continuing work on the measure progresses, so that will be like the introduction of the regulations, the introduction of codes of practice for consultation and what have you. If you want to be added to my mailing list, in other words, and get updates on the measure, all 4 parts of it, as work progresses, do come and let Barbara or I know, and we'll make sure that you get those update emails. Thank you very much for listening. Cheers.